A patient with severe toothache visits the medical facility. The receptionist did not greet the patient and didn't show any welcoming gesture. As a routine question, she inquires the patient complaint. The patient was talking in his native language, which the receptionist could not understand. The patient tries to explain his tooth pain by holding his cheeks. The receptionist was unable to understand the language of the patient and assumed that the patient was having an ear pain. She opened the file for ENT consultation and sent the patient to the ENT clinic with the OP ticket. The patient arrived to the OPD clinic and handed over the ticket to the nurse. The nurse did not introduce herself at all and did not identify the patient either. While taking the vitals by chance, the nurse identified the patient as having a toothache and not an ear pain. She advised the patient to go back to the reception and take an OP ticket for the dentist. Back to the reception, the annoyed patient pointed at his tooth and acted that he's having a toothache and needs to see a dentist, not an ENT doctor. This time, the receptionist understood the actual patient complaint and changed the OP ticket for a dentist. She asked the patient to head to the dental clinic and fails to apologize for the inconvenience caused. At the dental clinic, the nurse fails to establish a rapport with the patient, and she does not inquire about the patient complaint. After collecting the OP ticket, she fails to confirm the identity of the patient and directly sends him to the consultation room. The doctor recognizes that there was a language barrier. He neglects to take the medical history and does not bother to inquire if the patient has any allergies. As a routine practice, he does the oral examination and identified that there was an infection. He informs the patient that the tooth needs to be extracted. However, the dentist does not explain the cause of the problem, treatment options, treatment plan, risks and the complications of the procedure with the patient. He also fails to take the consent form from the patient. He goes ahead with the tooth extraction, which leads to uncontrolled bleeding. The case ends up being a medical emergency. We could see a series of wrong process and procedures in this patient care resulting in harming the patient. Here, engaging patients in the treatment plan and decision making could have avoided harming the patient. A patient with severe toothache visits a Middle East medical facility. The receptionist greets the patient with a warm welcoming gesture and politely inquires about the patient complaint. The patient was talking in his native language. Identifying the language barrier, the receptionist apologized to the patient and calls for the translator for assistance. Upon arrival, the translator greets the patient and communicates with the patient in his native language. This helps the patient to speak up comfortably about his problems, ask questions about the services and specialists available. He also clarifies about other information needed. The translator identifies what matters most to the patient and work with him to meet his expectations, needs and preferences. She informed the receptionist to open an OP ticket for the dentist and assisted the patient to the dental clinic. On the way to the clinic, the translator maintains an ongoing dialogue with the patient to encourage trust and satisfaction. She ensures that the patient is informed about his rights and responsibilities with regard to safe care. The dental receptionist greets the patient with a warm welcome. The translator introduced the patient to the receptionist and informed about the language barrier. She requested the receptionist to call for a nurse who can speak his native language to assist him. The translator then assures the patient that a dental nurse will be coming shortly to attend him. The dental nurse greets the patient and inquires about the patient complaint. After collecting the OP ticket, she confirms the identity of the patient correctly. The vital signs has been taken and documented in the EMR. She then accompanies the patient to the consultation room. The doctor greeted and welcomed the patient to his clinic. The doctor confirmed the identity of the patient and took the medical history. He understood the patient is having a cardiac problem and is under medication. He also inquires about any known allergies of the patient and documented this in his notes before proceeding with the oral examination. The dentist identified that there was an infection which caused a severe pain for the patient. He explains the treatment options and encourages the patient to participate as partners in his own care and promote shared decision making. He provided informative tools and educational materials to the patient to enhance his awareness and knowledge of safe and effective self-care. The dentist explained the treatment plan to the patient and prescribed a painkiller for the pain management. He advised the patient to take antibiotic for the tooth infection and to do a tooth extraction after 5 days. The dentist explained about the risks and the complications of the procedure. The dentist informed the patient needs a cardiac clearance for the tooth extraction and referred to a cardiologist. He also advised the patient to come with a bystander after 5 days. After 5 days, the patient came with a bystander and a cardiac clearance. The cardiac clearance was seen by the dentist, who then provides a consent form to be signed by the patient, making the bystander the witness. The procedure was done and he provided the informative tools and post-extraction educational materials to the patient to enhance his awareness and knowledge of safe and effective self-care.
Safe healthcare is a fundamental right of all patients everywhere, every time. Patient and family engagement is a key strategy to developing safer health systems. Patients and families should be involved at every level of healthcare, and no one should be harmed in healthcare. We at Middle East Medical Facilities renewing our commitment to provide a safer healthcare to our patients.